First, let me start by congratulating Heartland Health Center for its sixth annual From the Heart Gala. I served as the first executive director and medical director of Heartland Health Center back in 2005. And now I serve as the White House vaccinations coordinator in the Biden-Harris administration. A lot have changed over the last 15 years, but one thing hasn't changed, and that's Heartland Health Center's commitment to the communities it serves. So thank you for everything you've done. Thank you for everything you're doing and you will do in the future. And most importantly, thank you for the 10,000 shots of the vaccine that you've administered in Chicago. I'm so grateful for you all. And please invite me in person next time. Congratulations and enjoy the gala.
Good evening. Welcome to Heartland Health Center's 6th annual From the Heart Gala. My name is Val Warner from ABC7's Windy City Live, and I am thrilled to be your host this evening. Although we all had hoped we'd be in person by now, I promise we are in for a fantastic program for you, and you don't even have to leave your living room. This is still a party, so let's hear from you. Join the chat and tell us why you love Heartland Health Centers. Take a picture of yourself and share that with us. And those of you who are having house parties, make sure you take a picture of your group. Tonight's theme centers around 3 words: innovation, investment, impact. Our program will show how the work of Heartland Health Centers underscores these 3 words and how the incredible team at HHC provides quality, comprehensive, patient-centered care to 30,000 patients annually. This is HHC's biggest fundraising event of the year, and all money raised tonight will go directly to support the vital services Heartland Health Centers delivers every single day. Please hit that donate button and do what you can to help us reach our fundraising goals. Now, let me introduce to you 2 people who can tell you a whole lot more about the amazing work of Heartland Health Centers, CEO Nicole Willis and Governing Board Chair Tom Serafine.
Thank you, Val. We are so honored to have you with us this evening. And welcome to everyone who's watching tonight. We have all had another challenging year, but something that has sustained me is to work every day with some of the most dedicated and compassionate people. Tonight, you will see some of them in action, as well as hear directly from patients and community members about how the care provided at HHC is truly from the heart.
That's right, Nicole. I'm so impressed with how quickly HHC mobilized to get people vaccinated while continuing to ensure the highest quality care for our patients. We hope tonight's program will convey the critical role FQHCs play in our community and move you to support these vital services in any way you can.
Okay, let's kick things off with some footage of our vaccination team in action. This first segment shows how HHC made a huge impact in increasing vaccine access to our communities.
Well, we've had a year and a half of having to be flexible. There are a couple of us who have had the privilege of leading and being involved in COVID efforts since the beginning, testing, and now vaccinating. We developed a plan really quickly to have patients start to come to our Devon Community Health Center for vaccines. We did that for several months and realized we'd like to do more. So we found this wonderful space at Northeastern.
The staff here at Northeastern have worked very closely with Heartland to set up in our gym. As you can see, it's very spacious and comfortable for people to come in where they can feel safe.
They've been a tremendous partner to us, and now we can vaccinate around 300 patients a day. That's up from about 140 when we were at our Devon space.
This is our second shot, so we feel very safe. You know, we feel more safe for people, especially because we have a business on the street. So we can take care of the customers and the customers can be safe, you know.
We have a full-time nurse practitioner, Nelly Castillo. She's on site with us 24/7. All of our medical or our clinical folks that you see behind me are either trained EMTs or RNs. We have an LPN and then the rest are medical assistants.
Oh my gosh, let me tell you about my team. I think it's been the most the best experience I've had, and I'm trying not to cry because this is coming from the heart, but what we've done here with all this family, with all the patients here, is just so heartwarming to me. And the way that, we've worked together from struggles, from headaches, from stress, to just make sure that everybody gets a vaccine and that everybody's safe and comfortable to get it. And just knowing that the people always have our backs, they have my back, I have their backs, and that we've worked sleepless nights just trying to get through this. It's just, my team is just the best.
Well, I'm not an anxious person, actually. So I'm the kind of person who needs to get vaccinated because I'm one of the slackers. So making it easy for me, not having to drive miles away, and that was really good. Because guys like me need to be told, tomorrow, great, nearby, done. And then we actually do what we are supposed to do, which is get sorted out.
The same day they asked me if I want to get the vaccine, the same day they give me the appointment, so we come through here right away, yeah.
Immediately I got the text, I responded to the text and got an appointment this morning, and that was yesterday afternoon. So it couldn't have been quicker. I can't say enough about Heartland Health Centre from my personal experience so far. Really like them, great. Fantastic staff, really young, really smart, in spite of being young.
Yeah, we were given a shot to host this vaccination event, pardon the pun, and we were contacted by the local alderman's office, and it was just a chance to give back, to do something community-oriented.
Today we're partnering with several community organizations, including Centro Romero.
We started the partnership with Heartland as a community navigators, and then we were participating in different events that Heartland has, doing outreach or now collaborating with the vaccine.
Centro Romero has a long-standing community base within different neighborhoods, so they're helping us to connect with those individuals. The Alder People's Office is also doing the same thing, and we're also providing food boxes in partnership with Advocate Aurora and Lakeview Food Pantry. So they're providing food boxes with produce and dry goods to anyone within the community that is in need. We're bringing vaccines to everyone ages 12 and up. We strongly believe in partnering with everyone and working together to make sure that our community is aware of the services that we provide.
By having the possibility of doing this kind of work alongside all of these organizations, we make sure that we're investing in communities. We are making sure that we're giving opportunities for members of community to serve and to create collaboration that is so important in this particular time.
Our community are without health insurance or without any prevention. They need several services, especially health services.
I live right around here, so I got a slip of paper telling me, and I thought it was pretty cool that you got the vaccine and then got to get groceries afterwards.
Heartland investing in the community make us stronger, and we know that united we can do good things and better things for the community and the future.
The need in our community is so great, and so that really means that we all have to come together. Small businesses like Revolution Brewing, community providers like Heartland Health, like Centro Romero, all of us coming together to be able to provide this service here in our neighborhood is really what makes these events a success. Folks are familiar with our community providers, so when we say, hey, come and meet us in a location in your community, and when a local establishment like this one is able to open its doors and provide that support, that's really the secret sauce.
This morning, we are in the gymnasium of the Chicago Math and Science Academy with Heartland Health, and this is our second shot event for our community vaccine for COVID.
They're hoping to give 500 shots today. So this is what's prepped. We have a long way to go.
We are here with a bunch of residents in the neighborhood. We've got partners with our Centro Romero, a lot of volunteers, tons of volunteers from the neighborhood.
With the inclusion of different community-based organizations like Centro Romero that took the lead on this with their large network, and we're able to call people, we're able to reach out to people that might otherwise not really know how to do this just because internet's an issue, language is an issue. Even just having the technology to make an appointment can also be an issue.
As a community with more than 80 spoken languages, with people of all economic brackets and all educational backgrounds, it's difficult sometimes to find a group that can connect to so many people, and Heartland Health has done a fantastic job of that.
Why did I choose to get my vaccine? I think, in a way, this is not about me choosing. No, this is about the safety of a larger population. I know that I can be a good influence in my society, in my community, by setting the example of getting my vaccine.
I am deathly afraid of needles. And this whole time, the big thing that scared me is getting a shot, not because it's a vaccine and not because it's COVID, but the actual needle. And everybody was very, very nice, actually very sweet, and I hardly felt anything at all.
He also didn't like the fact that it went very quickly. That line moved very fast,
I was freaking out
and
the whole
everything
time the
was
line
very
is just
efficient.
moving quickly, but you know, in the end, it was like I hardly noticed it.
You couldn't get a vaccine at the Walgreens here. You couldn't get a vaccine at our Jewel. You couldn't just walk in and get a vaccine at any of our clinics, and we didn't have a hospital that served us where people could go either. And so there was a real need to have a vaccine event here in our community for our residents.
Makes me feel like I'm doing my part in getting us back to the normal. So yeah, it makes me feel a little special that I'm able to help people get their vaccinations because we are saving lives.
I'm very grateful for the number of volunteers. I think the volunteering is our last resource to move forward to build a better society, a better world. I'm grateful for the work that the Heartland Health Centers are doing to make the vaccine accessible. So for that, I want to say thank you.
Wow, that was amazing. Maybe you're asking yourself right now, how can I support this incredible organization? Well, lucky for you, we have made it very easy to donate. And remember, no gift is too small or too big. And if you buy a raffle ticket, you can win up to $10,000. Remember, every dollar raised tonight goes directly to providing quality, affordable health care in our underserved communities. Please give what you can and help us reach our goal. Many of you at home have received a gala kit from us with everything you need to get your house party started. So to help us get in the spirit, please welcome our guest bartender, Ingrid Rodriguez, who will demonstrate how to make tonight's signature cocktail.
Hi everyone, and welcome to Heartland Health Center's 2021 Virtual Gala. I hope you're having a great time, and to make sure that you do, I'm going to show you how to make this year's compassionate cocktail. So it's going to be our version of a Moscow Mule, so it's going to have a little bit of a fall twist at the end. Go ahead and grab your glass. Traditionally, Moscow Mules are made in copper mugs, but here at the Royal Palm Shuffleboard Club, we love mason jars. So if you have a jigger on hand, fill it with 1.5 ounces of vodka, or if you have a shot glass on hand, fill that to the top. We're using Tito's, delicious. And it's going to require 1/2 ounce of lime juice, or roughly equivalent to 1/4 of a fresh lime's worth of juice. Top it with some ice and fill it with some ginger beer. And now to give it that fall twist, hit it with 2 dashes of Ango bitters and 1 dash of orange bitters. Stir that bad boy up and garnish with a lime. Delicious. Now sit back and enjoy the rest of the night, and don't forget to donate. Cheers.
By now, I hope you and your guests all have your cocktails or your beverages of choice in hand, and you are enjoying yummy nibbles from J&L Catering. Now, sit back, relax, and enjoy the program, and don't forget to donate. Earlier, you got a little taste of how Heartland Health Centers and other FQHCs played critical roles during the pandemic. Well, the City of Chicago also recognized the remarkable contributions of FQHCs, and Mayor Lori Lightfoot presented them with a shared award. Much like the passing of the Stanley Cup, CEO Nicole Willis recently got the award from our friends at Esperanza. Take a look.
Welcome everyone. My name is Dan Fulweiler and I'm the CEO of Esperanza Health Centers. And I'm extremely excited to be here today with Nicole Willis from Heartland Health Centers to present her with an award that we are very proud to have received from Mayor Lori Lightfoot, the mayor of the city of Chicago. What this award is the Mayor's Medal of Honor for the amazing service that federally qualified health centers in the city have done for our patients during the COVID-19 pandemic. And we share this award with Heartland, who's done equally amazing things. So Nicole, I'm really happy to present this to you.
Thank you, Dan. We are so thrilled to work alongside Esperanza and the 20 other FQHCs in the city that shared in this award. Heartland proudly works towards reducing the barriers of care in the communities that experience them most often. Our collective efforts to protect and care for our patients during the pandemic has truly been inspiring. We look forward to passing on this award to another FQHC later this fall.
Thanks Nicole.
Again.
Yeah,
thank you.
Take care.
What a huge honor for all FQHCs in the city of Chicago. Congratulations again. Next, we want to tell you about an important way HHC is investing in community health with a special medical assistant training program called the National Institute for Medical Assistant Advancement, or NIMAA. I think you're going to really enjoy this.
NIMA is an online school for medical assisting, and from day one, they are in the clinics. So they have about 3 hours online sessions on their laptops, and the remainder of their day here in the clinic is hands-on with their preceptors.
Having a preceptor here at Heartland has been extremely helpful. I've been having hands-on training, which has been great, and even outside of Heartland, she's always communicating with me, making sure that I'm doing well if I have any questions, and I really appreciate that.
I'm very proud of being a medical assistant and being the privilege to teach our NIMA students, because our role as medical assistants are huge. We have a huge impact on our community. We are here to serve and help our patients any way we can.
What I really like about the program is that it's very hands-on. I, for one, am a very hands-on learner. I like to do things physically. It makes it easier to memorize, and you also get that experience at the same time while you're learning.
My position as a trainer is very important because the point of it is to help the person you're training understand what's going on. For me, it's like they'll learn better if they're doing it.
The NIMA program, I really like it because it fits into your personal life and your work schedule. And it's like you're learning stuff from the book, but also doing it in the clinic.
I found out about the NIMA program through social media. I knew I wanted to go into the medical field. I took that leap of faith and decided to do it, and I really love it.
I was looking into other nursing programs, but it was mostly like you had to go full day. It was like an 8-hour, so it didn't give me time to work. So that's why NIMA, I think it's a really great program.
I'm really excited about this program, and I'm really excited that I got accepted into it just for the fact that it's very affordable. And on top of that, Heartland Health Centers did cover a portion of it, which I really appreciate. And I also got a job here as well.
A lot of these students are fresh out of high school. They're not sure what they want to do. They hear about NIMA and they're like, okay, great. I can still work full time. And now I can get this really good introduction to the medical field. So if they do choose to move up in wherever, way they want to, medical assisting through this NIMA program is a really good first step.
I wish I would have known about the program years ago. I mean, it would have helped me personally. When I graduated high school, I wanted I want to be an RN. That's what I wanted to be. I had no idea, that you could be a medical assistant and work your way up to an RN.
MAs are very critical to healthcare, especially in community clinics. The MA is the one that's outreaching that patient sometimes. They're getting the vitals, they're building connections with that patient.
What's fulfilling for me is that I'm actually helping the patients. That's something I always like doing, helping people out.
As a medical assistant, our work is important because we help the providers better understand what the patient's here for. We help the patient understand the doctor as well. You know, sometimes, you know, they call it doctor language. Patients don't always understand that. That's where we come in.
NEMA is actually a really great way of kind of reaching out to different communities and bringing them into a healthcare environment.
Being able to serve my own people and give back to the community, it's very fulfilling to know that I can help in that way.
The responsibilities of the community health center is to make sure that everyone in the community is being taken care of, knowing all the resources that are available to them, and also providing them care regardless if they have insurance or not, making sure that they know that their health is our #1 priority.
Partnering with NEMA is one way Heartland Health Centers is investing in the future of community health.
Wow, that was so inspiring. What a cool program. And did you know that Heartland provides scholarships for NEMA students too? Your gift of any amount will help keep these scholarships available as well as support all of the work of Heartland. Please consider giving what you can. We are getting there together. We now have a very special video to share. The local band Course just released their debut album titled A Late Hour. It just so happens the lead singer is the stepdaughter of one of Heartland's partners and supporters, Patrick Thompson of MDT Architecture.
Hi, I'm Pat Thompson of Mansky Deacon Thompson Architects, a proud supporter of HHC and a member of the Gala host committee. I'm thrilled to introduce the band Course featuring my stepdaughter, Jessica Robbins. Enjoy.
I go, don't call it luck. Whatever's waiting, whatever's gone, don't matter if I'm where you are. Say it, we were 16, running from something. We were 16, we all
What a beautiful song. Jessica, thank you so much. And of course, thank you to her bandmates from Chorus. And check out their whole album, A Late Hour. Next, we have a segment showcasing the amazing patient-centered care happening at the Innovation Center of Albany Park, or ICAP. ICAP is located at 3737 West Lawrence and is but one of HHC's 18 locations. I'm so excited to show you how their innovative model is positively impacting patient care and provider joy.
Despite having amazing staff here at Heartland and across much of the healthcare system, we know that the system that we work in is not functioning as well as it could or should. And so it's leading to a lot of burnout. And it's also preventing patients from getting the care that they deserve and that they need. So we started talking about, well, how do we actually change our model? And we looked and we realized, well, this is innovation work. So we thought, well, let's form an innovation center where we can have the space to create a different model and to work on different technology. And so that's why we formed the Innovation Center.
And a process like this is so important at a place like Heartland where we have 18 sites and we get to try something out, make it better before it's spread to the rest of the organization.
For us, our innovation is actually pretty basic, not high tech. It's about bringing relationships back into healthcare. Relationships between patients and providers, between patients and care team members, between care team members and each other.
I think that we are very innovative, not just from the projects that we do, but starting off our day with our daily huddle. We are mostly like a family here. In the beginning of the day, when we start off on a positive note. So we will ask different questions about what brings you joy, what made you happy, just to start off with a positive note. And everyone chimes in, we laugh, we're very cohesive here.
The advanced team-based care model is a two-caregiver model focusing on the care team coordinator role. Basically, the clinician and a care team coordinator are present in the room with the patient the entire time, as compared to where the medical assistant vitals the patient and then leaves.
The biggest difference between the traditional medical assistant role and my role as a care team coordinator is that I join during the visit with the provider. So after I room the patient, I come out, kind of brief the provider a little bit, and then they'll take a look at my notes, and then we go in together and do the visit.
One thing that I've noticed with having the CTC involved in the patient visit is they have gotten closer to the patient as well. They're seeing the joy that I as a provider have when I'm interacting with a patient. They get to experience that as well. And then that gets them more invested in helping the patient, and then we together are a more effective team.
I prefer this model that we have here, the 2-to-1 model, as opposed to the 1-to-1, where there's a provider and a CTC with the patient, because I really like being there for the visit and understanding what's happening in their care. It makes me feel like I can give them better care as a CTC. I can ask them more specific questions next time they come in. And it makes me get to know them a little bit more. I feel like I have a relationship with the patients that come in.
I like this model better because it is more effective for me as a clinician, because I'm able to sit face to face with my patients. I'm no longer buried in the EMR.
Something that's really exciting to see is that some of the work that's been done here now is being spread to Lincoln Square. To watch the providers over there maybe initially be dubious and then hear more and then get really excited as Asia's working with the care teams over there and they see the possibilities of this it shows that it's all worth it, and it really kind of shows what this is about.
When I first learned about this program, I was skeptical because I've been trained to do it all. And even though I recognized that that was not sustainable, I wasn't sure how a new program would work. Now that I've started to see what a CTC can do and what the whole team does together, I'm solidly behind it. I'm very much a cheerleader.
They do build relationships with patients, but they also build relationships with one another.
Erika and Pencils, they are working like the best team, I think so, here, because you can feel it. You can feel the way that they are working.
We do work as a very close team, and in knowing how our teammates are feeling, we're able to step up and step in to make sure the ball is not dropped anywhere when giving patient care.
When I come here, like I say, I see the same person, I talk to the same person, and I know where I already did and what I'm gonna do. I was one of the person decide that not having the vaccine, and even I talked to many of other people that I'm not gonna get it, but they convinced me to do it. So, and I took my vaccine here. That is something I can say that I'm more comfortable with them, because I have my workers that we talk, so I also told them that, you know what, I got my vaccine and I think it's the best thing to do, so do your own also. So I know many already did.
It's so awesome to see the progression of this care team model and the work they're doing, but there's also lots of little things that come out of ICAP. We have the space here to try things out and work on things. They can perfect it, and then we can spread it to the rest of the organization. Things as simple as some of the forms in our electronic medical record, some other forms that we use on paper, but just helping to streamline our process.
Sometimes it's just little things that make that much easier for the patient, and sometimes it's bigger, more transformational projects. The nice thing about the Innovation Center is that they try these ideas out, the creative ideas, and see how to improve it and then implement it elsewhere.
Innovation is a process of discovery and learning, and we do that and we test ideas, and then we see what works and what doesn't work, and on a small scale. So that's the benefit of being on site.
I've always been impressed with Heartland's ability to be ahead of the game in terms of innovation and trying to bring on new projects. Now I'm even more excited about the possibilities. We have really broken ground by doing the CTC program, and I think it's going to open up more doors for us and really help us to transform our practice and be the health center of the future.
Well, I know you are motivated to donate. Now, if you haven't already, what an impressive model of care. And just a reminder to please take a moment to share in the chat if you donate and why, and then let us know you are here by posting your pictures. This year, you don't have to be dressed up. You just have to show up and participate in any way you can. And again, thank you to everyone at home. Every gift is truly making a difference. All right, now I am pleased to introduce our next entertainment segment of the evening. Please enjoy the exquisite piano stylings of Devin Shaw, a student of the Jazz Institute of Chicago.
Hi, my name is John Foster, and I'm the Education Manager and Student Council Coordinator here at the Jazz Institute of Chicago. We are so pleased to be a part of tonight's gala celebrating the incredible work of Heartland Health Centers. Founded in 1969, the Jazz Institute of Chicago promotes and nurtures jazz in Chicago by providing jazz education, developing and supporting musicians, building audiences, and fostering a thriving jazz scene. Tonight, I'm so proud to introduce for your listening pleasure Devin Shaw, who is one of our Jazzling Student Council members, and he will be playing for you all The Nearness of You. Devin is a graduating senior who's leaving Whitney Young and going to the University of Miami this fall. So thank you so much, and we hope you enjoy.
Thank you all for having me. My name is Devin Shaw. I'd also like to thank the Jazz Institute for having me as well.
What a talented young man. Thank you so much, Devin. And we are definitely wishing you the best of luck in your very bright future. Next, we are moving to women's health at HHC and how investing in key staff and equipment has allowed the women's health team to make lasting and meaningful impacts in the lives of their patients.
In a normal OBGYN office, you would see an ultrasound there. There would be LEAP machines and monitoring like NSTs for babies, and we didn't have any of that when I started. And so navigating how to take care of our patients as best we can with the services available required lots of hurdle jumping.
In many other countries, women are surrounded by aunts and cousins and parents and or mamas and grandparents who have all breastfed, neighbors, friends. So there's a lot of built-in support. Here in the States that is harder to come by.
We've been running the women's health program for years now, but in the last year we've seen substantial growth in terms of the number of patients that we're seeing and growth in our teams and infrastructure to support those services.
When we started, we were basically trying to expand from only doing low risk to prenatals to being really the safety net that Heartland Health Centers as an FQHC is supposed to be, which means we started to expand to we will take care of any pregnant lady that we reasonably can unless you have a very unique high risk issue. And part of that is being able to do more intensive monitoring, and the standard of care is to be able to provide regular ultrasounds and this thing called NSTs or non-stress tests.
We recently got a grant, and that grant is going to provide us with a community health worker, a breast health navigator, who will help to track all of our abnormal mammograms and help our patients follow up on their abnormal mammograms, getting in for breast biopsies, for ultrasounds, and tracking those and providing assistance to all of the patients at all of our clinics that have abnormal mammograms.
Now we can go from pap smear to colposcopy to treatment all within a couple of months, which is, gives me chills. It's awesome because it's so efficient and good for patient care. This year we've really ramped up being able to provide for some patients needing every week an ultrasound and an NST for 2 months. And so instead of what we used to do, which is send them to the hospital, do the ultrasound, then go up to labor and delivery and get the monitoring, which would mean 4 or 5 hours every week at the hospital, we can now do all of that within a 30-minute visit, including the visit with us here.
The breast health navigator position is critical to help our patients not fall through the cracks. Unfortunately, patients who don't know how to navigate the system often don't go to their follow-up appointments. The breast health navigator will continuously outreach these patients to help them get the care that they need. It's going to be critical to follow up, and also, for patients that have breast cancer, we're going to provide behavioral health support and other support to them as well.
There's major obstacles for our patients to achieve health care. They have geographical restrictions where they can't travel. They may or may not have insurance. There's a lot of lower literacy in terms of what your health means for our patients. And so being able to do it all literally at one site has made things so patients are understanding better and getting access in a more efficient and careful way.
The lactation program was developed as a result of needs of our clients. And so in this case, prenatal mamas or pregnant mamas needing information about breastfeeding.
I actually accessed our breastfeeding services when I was pregnant with my first child, and I knew nothing about breastfeeding. I felt very lost, and through one of our great nurses here who is very intimately involved with our women's health team and with our patients, she coached me. Even pre-birth, I already felt very empowered to own my journey through breastfeeding my child.
The lactation program has affected our patients in that there has been more breastfeeding success. We have mamas who are breastfeeding longer, and so we ultimately will have healthier babies.
I wanted to breastfeed my son Michael, and Mary Beth helped me with that, and she gave me a lot of support. I met with her several times before and after giving birth, and she showed me how to get a good latch. It was very difficult at first because my breasts were hurting a lot, so I almost gave up. I thought, this isn't for me. But thanks to Mary Beth and also Dr. Bouye, I didn't give up. The pain went away, and for months after, I'm still breastfeeding my son.
The investment in women's health has been huge in terms of expansion of providers and support staff and managers, and it's grown from 2 family practice doctors to 2 OBGYNs, 4 or 5 family practice doctors, a midwife. We've got 2 different managers, we've got OB care coordinators, and it's really grown and invested into this huge program just in terms of people. But then when you think of all the equipment that's also been invested in, the Elite machine, the 2 NST machines, we've got 2 ultrasounds, 3 colposcopes, that's come from less than one of most of those things.
I feel very fortunate to be part of the women's health team at Heartland, and I really do feel that our clients are embraced by the entire team.
One of the coolest things is this is a closed loop treatment. So you go from pap smear to diagnosis to treatment all here in one place. And by doing these leaps, we're preventing cervical cancer. We're saving people's lives.
I am so proud of the investment that Heartland's made in the women's health program, whether it's tracking women and helping them follow up on abnormal mammograms, helping high-risk women navigate the healthcare system. We provide services on site such as LEAPs and colpos. This amazing investment has been very impactful to our patients at Heartland Health Centers. Not only the patients, the providers, the nurses, and all the staff at Heartland Health Centers.
What an important work that team is doing. Thank you, Heartland Health Centers, for investing in women, children, and families. And tonight, we invite you to invest in community health with a donation to HHC. And of course, again, huge thank you to all of our sponsors.
Hi, my name is Lorraine Cragen. I am the CFO of Visualutions. We are honored to partner with Heartland Health in their day-to-day care of their patients and support them for their 6th annual From the Heart Gala. Heartland has journeyed this past year with innovation of care for their patients, investment in their organization and their people, and are making a huge impact in their community. Thank you for joining and supporting Heartland with us.
Innovation is everywhere. The spark of inspiration, the action of choosing to do things differently. Whether you're still defining business targets or already have established plans in place, there's room to be innovative. At Impact, we think every company has the potential to stand out amongst their competition. We look at what's already in place, along with your team's wants and needs, so we can customize our applications and connect you with the right specialists to work with you from ideation to installation, implementation, and beyond. It all depends on you, your timeline, and your budget. What is innovation in your business going to look like? Let's find out together.
Now we have some inspiring people and organizations to honor tonight. Please welcome back CEO Nicole Willis.
Thanks, Val. Tonight we are so happy to honor 2 partners who helped tremendously in our efforts to get the vaccine into as many arms as possible: Northeastern Illinois University and Central Romero. First, we present the Community Partner Award to Dr. Gloria Gibson, President of NEIU. When we were looking for space to expand capacity to safely administer vaccines, NEIU opened their doors. They could not have been more gracious and accommodating, and together we vaccinated thousands. Dr. Gibson, we are so grateful for your incredible generosity, and tonight we present you with our Community Partner From the Heart Award.
Hello, I'm Dr. Gloria Gibson, President of Northeastern Illinois University. I am so proud to be the recipient of the Heartland Health Centers Community Partner Award. This award means so much because it represents a collaboration with Northeastern representing and providing the space, and Heartland providing the expertise. And from this partnership, we were able to do so much with vaccinating our communities and certainly those here at Northeastern. Thank you so very much, and I hope that you enjoy the 6th annual From the Heart Gala. Thank you so very much.
Although I could speak volumes about our next honorees, I'm going to turn this over to Dahlia Gavin Morales, Heartland's Director of Community Engagement, Outreach and Enrollment, who can much better express why Central Romero is also being honored tonight.
Central Romero has partnered with us for over a decade, but when the pandemic hit, our organizations became even more aligned. Our common goal during this time was initially to get as many people as possible tested, and now is to get just as many people vaccinated. Central Romero has been helping us with critical outreach to marginalized communities. They organize volunteers to help us at the NEIU site and at community vaccination events. They have been a true ally, and without them, we would not have been able to reach the number of people we have. Centro Romero is a trusted organization on Chicago's north side, and their work has been critical to help us increase health equity in our neighborhoods. Tonight, it is my extreme honor to present Executive Director Daisy Funes and Family Program Director Susana Salgado of Centro Romero with the Health Equity from the Heart Award.
My name is Daisy Funes. I am the Executive Director of Centro Romero. Centro Romero has been serving the community for over 35 years. We serve communities of Edgewater and Uptown, the north side of Chicago. Centro Romero focused to serving the immigrants and refugees. Thank you to Heartland Health Centers for this honor. We are thrilled to receive the Health Equity, the award from the heart. Thank you again to one of our strongest partners organizations.
Good evening. My name is Susana Salgado. I'm the Family Service Director at Centro Romero. As part of our manifesto, Centro Romero is committed to achieving health equity for our community. Disparities in health existed before the pandemic. With Heartland Health Centers, we were able to provide our community with access to testings and vaccines for COVID-19. Thank you for this award. Thank you for everything you guys all do at the organization, at your centers, and congratulations on your annual gala. Hola, buenas noches. Muchas gracias por este reconocimiento. Parte de nuestro o del esfuerzo que hacemos en nuestra comunidad es darle a nuestra comunidad o proveerle a nuestra comunidad acceso a un cuidado de salud accesible y de calidad. Con nuestro partnership o nuestro acuerdo, el trabajo que hacemos junto con Heartland Health Centers nos ayuda a darle esto a nuestra comunidad. Muchas gracias a Heartland Health Centers y felicidades en su gala.
Thank you, Dahlia, and thank you to our friends at Centro Romero. Now please welcome Matt Katzfei, HHC's Development Board Chair.
Good evening, everyone. I'm thrilled to introduce our final honoree of the evening, founder and CEO of My Block, My Hood, My City, Jamal Cole. After George Floyd's murder, like many organizations, HHC looked for ways to support and give needed space and time for staff to process this trauma. What evolved from discussions was a desire to do something together and make a positive impact. The work of My Block, My Hood, My City resonated with HHC to such a degree that the staff quickly rallied to raise $1,000 in a collective employee donation. The ways in which My Block, My Hood, My City is investing in our communities is truly inspirational. From shoveling snow for elders, delivering food and PPE to those in need, organizing peaceful protests, and raising $1 million for small businesses impacted by vandalism, M3 is creating positive pathways for youth to envision and actively create a kinder and more just world. True to their mission, they inspire youth, empower communities, and build a better world, one block at a time. What is something small I can do to have a positive impact on my block? That is a question Jamal encourages all of us to ask ourselves and then to act. Heartland Health Center CEO Nicole Willis recently sat down with Jamal to present him the Community Investment from the Heart Award. I hope you enjoy their conversation.
Hey Jamal, thanks so much for taking your time today to meet with me. Can you tell me a little bit about yourself, My Block, My Hood, My City?
Yeah, well, thank you for showing up. My Block, My Hood, My City, that's what we do, is just show up. We don't have any programs per se. Our mission is to take care of people no matter what. So if there's a snowstorm, we go out and shovel snow for seniors. If there's a heat wave, we go buy waters and fans, and we deliver them directly to seniors. Throughout the pandemic, 8,000 seniors reached out to us from 12 different states. We were able to connect them to primary healthcare physicians. If a meteor hit Chicago tomorrow, we'd be out there sweeping up meteor dust. So we love what we do, and our mission is to take care of people.
Okay. Tell me a little bit about yourself. I understand you might be running for Congress soon.
Oh yeah, I mean, I love what I do at My Block, My Hood, My City. I've been doing charity for a long time. Now I'm doing reform. I could pass out turkeys on Thanksgiving for the rest of my life, but people still gonna be hungry on the 29th. We can give out emergency grants to small businesses and families, but people still gonna be, dying of poverty. We could give out, we could fund peace grants on major holidays to help stop crime, but there's still gonna be too many shootings, because those aren't nonprofit problems, those are policy problems. And so I'm running to be a partner in federal government for nonprofit organizations.
That's exciting.
Yeah.
Well, like many organizations, after the murder of George Floyd, Heartland Health Centers, we sat down with our team to understand what some of the challenges they were facing, because a lot of them live in the communities that were impacted. And so what we came up with as a group is that we wanted to do a collective donation to My Block, My Hood, My City. So that's what we've done.
Thank you. Thank you. We need partnerships between corporations, nonprofits, and even government. And so thank you guys for stepping up. We couldn't exist without the generous donations from corporations. Like, we are a 501c3 nonprofit organization, so thank you. And it's also encouraging to see that you guys, it sounds like a place that people want to work. People want to be involved in companies that are involved in social justice. So thank you for, being an outlet for your employees. That's dope.
Thank you.
Yeah.
One of the things that our theme for our gala this year is investment. Can you tell me what that means for you?
Oh, investment is the solution. I mean, a lot of times when I think of policing in Chicago, I think of reactionary policing, where we put shot spotter technologies on poles to listen to gunfire. We put police officers in schools. That's reactionary, but investing would be putting counselors in schools and not having the caseload for a counselor to be 1 in every 500 students, right? So investing looks like investing in opportunities instead of pushing money towards punishment and putting people in jail. So you can't tell kids what to do if they don't have anything to do. Let's invest in some after-school programs. Let's invest in some technology and invest in the kids' future, basically.
That's amazing.
Yeah,
thank you.
no doubt.
So can you tell me what inspires you, what gives you hope?
Yeah, I have a 10-year-old daughter, and she inspires me. I have a 3-year-old daughter as well, and so my 2 daughters, both of them are activists. One's empathetic and one's compassionate, right? Okay. One's like, it's the 3-year-old, and the other one's like, she'll give everybody a cupcake in her class, and that's just how she is. But anyway, those 2 girls right there are, those are my 2 presidents, and so yeah, they inspire me.
That's great.
Yeah.
Well, on behalf of Heartland Health Centers, I'd like to present you with the Investment in the Community from the Heart Award.
Woo! Hey, thank you. I mean, this is a beautiful award, definitely the prettiest award that I have. My daughters definitely will take this one from me, but I will just say, like, everything I do is from the heart, and everything people on my team do. I get a lot of awards, but I got a great team. I got to shout them out. Like, my entire team is full of leaders, and we love helping people. That's why we're here. So thank you.
Thank you. Thank you for all that you do. Thank you for the work that you do in the city.
Yeah, thank you.
Appreciate it.
No doubt. I just want to say congratulations, Heartland Health Centers, on your annual gala, and thank you for investing in communities. That is the solution. We need investment. So thank you.
Congratulations again to all of the honorees. What an impressive lineup. Before we close the program, Development Board Chair Matt Katzfei is here to recognize the members of the host committee that made tonight possible.
I hope you have enjoyed tonight's program as much as I have, and that, like me, you are inspired to support the phenomenal work of Heartland Health Centers. As you saw tonight at HHC, teamwork is key, and that is true of our volunteers as well. Over 40 individuals came together and dedicated their time and resources to help make tonight a success. Let's take a moment to recognize a few and find out what HHC means to them.
What I like about Heartland Health Centers is not only that it helps people, but it helps people new to this country who are in need.
HHC to me means access to quality health care for people that look like me.
Heartland Health Centers to me means finding value and care at a place that affirms who you are, where you come from, and where you're going.
For me, Heartland Health Centers means love. Love of our community, regardless of who you are, what you look like, where you came from, or your level of income. Love of healthcare for all, love of innovative healthcare practices, and sharing that love, kindness, compassion is what HHC is all about for me.
Access to high quality, affordable, compassionate healthcare is a human right. Heartland Health Centers is a lifeline to our communities. I've been an HHC supporter since 2013 and the proud co-chair of this year's 6th annual From the Heart Gala.
I love that Heartland Health Center serves everyone from infants to seniors, providing a wide range of services from dental health to mental health.
I want want to thank you all for joining us tonight. It has been such an honor to be here and be a part of this fundraising event for Heartland Health Centers. This brings us to the end of our program, but not the end of the party. Our own DJ Gak is here to get everyone on the dance floor, even at home, so stick around for the dance party, chat, and post pictures, and you still have time to donate. Thank you to all of our sponsors and to all of you for watching. Have a great evening.